Hi, I'm Dave Gardy for WebAble TV. We're at the Atlanta Marriott Marquis at the MAPS conference, and we're here at the NeuroNeeds booth, which is getting a lot of attention. And I'm here with Dr. Richard Boles, who is the Chief Medical and Scientific Officer for the company. Dr. Boles, this SpectrumNeeds is really attracting a lot of attention. Can you give us an overview of exactly what it is?
It's a nutritional intervention for children and adults on the autistic spectrum, actually with any neurodevelopmental disorder, including autism, epilepsy, intellectual disability.
And what kind of patients would use it, and how would they use it?
I use it in all patients with neurodevelopmental disorders, and I'm also using it with patients that have so-called functional disorders like chronic pain such as migraine, fibromyalgia, chronic fatigue patients including chronic fatigue syndrome, GI dysmotility such as irritable bowel, and the neuro-psychiatric disorders such as depression, anxiety, and panic.
Now, have there been studies on this?
There have been studies in autism that really show that a nutritional intervention makes a big difference, and particularly the ADAMS study. They took a nutritional component and they used it in a double-blind fashion, meaning that they didn't really know, the physicians and the family, the parents didn't know if the child was getting a placebo, just sugar, or if they were getting the nutritional intervention. And they showed that there was actually a significant difference, that the kids that were on the nutritional intervention, they had less outbreaks, they had less, autistic behaviors, they had improved cognition. They really did much better. And so what we did is we took the ADAMS formula and we added it to a high-powered mitochondrial cocktail. Now, in mitochondrial disease is uncommon in autism, but you do see it. But over half the kids with autism have mitochondrial dysfunction, in that there's just not enough cellular energy for the brain. The brain's electrical and needs a lot of energy. So this is a high-powered cocktail designed to really give the energy boost that the brain cells need to do what they need. So it's really the ADAMS study and the mitococktail together.
What have you seen in your own patients, doctor?
Well, I have an active clinical practice. I see a lot of patients with autism and other neurodevelopmental disorders, a lot of chronic pain and chronic fatigue. I've been using this for a year, first in the testing and then since February that it's come out commercially. It's really exceeded my expectations. It's really been fabulous in what it's been doing. A lot of the kids with autism have done much better, particularly behavioral outbursts have gone down. Mm-hmm. The cognition have gone up. Some kids that haven't spoke before are now speaking. Chronic pain is reduced significantly. It's even helped in chronic fatigue syndrome quite a bit. So there's been a lot of benefits. Also, the kids love the taste of it. Some of the competitors have really nasty tasting stuff, and the kids love this. It tastes like orange juice. You can mix it in water, orange juice smoothie, something like that. They really like it. And side effects have been really mild to almost non-existent, and they've been not a problem at all.
Excellent. Well, it's important that they like it. That's a big deal. We've been talking with Dr. Richard Boles, who is the Chief Medical and Scientific Officer for NeuroNeeds at neuroneeds.com. If you want to check it out and their SpectrumNeeds product. I'm Dave Gardy here at the MAPS conference in Atlanta. Stay tuned for more on WebAble TV.